Welcome to CNPA's webinar, Underreporting of Abuse, How is this possible? My name is Benedict Schöpflin and I'm the Executive Director of CNPA and I'll be your host today. I'm thrilled to welcome presenter Dr. Kerstin Roger, who's going to lead this presentation. Before we begin with the actual webinar, I want to go through a few tech tips and reminders for everyone. Obviously, first things first, this presentation is being recorded, so this is a reminder that you should mute yourself. You should already be automatically muted, but if for any reason you are unmuted, now is a good time to check. So you can do so on a phone by pressing either the mute unmute button or pressing *6. If you're on your computer, you can use your little microphone green button, click on it until it turns gray, and this means that you are muted. If you cannot stay until the end of the presentation, that is totally fine. Our presentation is, as I said, recorded and will be uploaded to the website later today, so you'll be able to watch it and listen to it later on. And the slides will be available on our website as well under cnpa.ca, CNPA webinars. They're also attached to your the automated email that you received this morning, reminding you of the webinar contains those slides. If you are experiencing any sound issues or connectivity issues, the easiest way to go about it is to simply log off, hang up, start again. You can also let us know in the chat box if there is a consistent sound issue, and we'll try to sort this out the best we can. I'm going to just briefly introduce our presenter. However, let me just swap my screen for a second. Hang tight. I had misplaced your bio, Kerstin. Okay, yes, one final reminder before I get to introducing Kerstin Roger. We're going to hold a brief Q&A at the end, about 10 to 15 minutes. So if you have questions and they're sort of, coming along while Kerstin is speaking, you can type your question in the chat box and I'll go through them at the end. And before we go any further, and it is very important for me to acknowledge that I'm holding and hosting this webinar on the land on which I live and work, which is the unceded territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh nations. Okay, so let's introduce our presenter today. Kerstin Roger is a professor in the Department of Community Health Science at Max Rady College of Medicine, the Faculty of Health Sciences at the University of Manitoba. Her research focuses on aging and the family, abuse of older adults, which includes mental wellness and caregiving, and how these interface with healthcare and a wide range of chronic illnesses. She's been a principal investigator on multi-site nationally funded research, as well as conducting provincial and regionally funded research. She has worked on international collaborations, local nonprofit community initiatives, and she continues to co-author and engage graduate students in her research and work. Now, I believe we can move on to the reason why you're all here. So, Kerstin, I hope you're ready. Don't forget to unmute yourself. And I'm going to make you a presenter as soon as I find you in my list. Here you are.
And just tell me, please, if you can see the screen.
We'll let you know as soon as you share it. Still waiting to view your screen, Kerstin. There it is. Perfect. Okay, no, perfect. I'll let you take it over from
Okay, it's on the first slide then?
Yes, it is.
Oh, okay, great. Well, I want to welcome all of you. I understand that about 80 people have signed up for this, so I think that's a very positive sign for interest in the topic. And I want to thank CNPA for hosting this webinar, but also in general for the work they're doing, because as we know, in everything that's happening in the news, it's so important right now. I also want to acknowledge the funder, Prairie Action Foundation, and I will introduce my team, who I'm grateful for as well, and many of them are attending the webinar here today. So before I do that, I also want to say that when we agreed to do the webinar and signed up for this, it was really pre-quarantine, pre-lockdown days. So this study started 2 years ago, and even the PowerPoint was prepared pre-COVID. So the focus here was on underreporting of abuse of seniors in the community. And I've been doing a lot of reading around the COVID situation, and I hope to weave that into the presentation, and hopefully we can talk about that at the end. But just to let you know that this study and this PowerPoint was really prepared with COVID not happening yet. So I'd like to just on the main slide here let you know that my co-investigators are Dr. Donna Goodrich in Saskatchewan, Dr. Christine Walsh in Alberta, and Michelle Ranville is our primary community co-investigator with Age and Opportunity here in Manitoba. And I've just abbreviated things on some of the slides, so you'll see that there are some abbreviations there. We're also very grateful to our research assistants, Marina Siwick, Labi Songozi, Carla Leipert, Kelly Hall, Kelly Granger, and then we couldn't do this work without our community advisory representatives, and that includes SCOA in Saskatchewan, Kirby Centre in Alberta, and A&O is also our community partner here in Manitoba. And so we're a pretty strong and mighty team. I think we've done some good work, and now we'll have to see how this continues in the next little while. So the study goals were not so much to look at types of abuse, but they were to look at communication around reporting and disclosure and how that process happens. So we received funding to work in a tri-provincial way with Manitoba, Alberta, and Saskatchewan. And my great hope was to explore the reasons for and context of underreporting cases of neglect and abuse. And as we continue, and as many of you know, issues around collecting data and reporting are quite grave. And so that really was the focus around this study, to address the knowledge gap of abuse with individuals and community and services, and to also better understand help-seeking behaviors of older adults. So to date, the study has included an environmental scan, media scan, literature review, qualitative interviews, and a review of quantitative annual reports. And so I will continue to describe some of those in more detail. I understand that there could be people from many countries and many places, although I assume most of you are from within Canada. But just to give you a sense that our Prairie Provinces are a unique region in terms of the population, some of the health issues we face, in terms of our geography, in terms of the type of funding we get. And so it is notable that we have a quick look at how the three provinces shake down. And so in Manitoba, we have one primary large city, Winnipeg. In Saskatchewan, also there's Saskatoon and Regina. And then in Alberta, we predominantly have large cities, Calgary and Edmonton. But in all of these provinces, we have many smaller towns and jurisdictions. And so this slide is just to give you a bit of a flavor of what we're talking about when we're referring to the Prairie Provinces. In the environmental scan, I'll just speak briefly about that to begin. We did both an overall scan of resources across the Prairie Provinces for older adults, just what generally exists for older adults. But we also began to do a media scan around what is coming up in the news around abuse of older adults in the community. And so what we began to see in both of those scans was that there is a great lack of resources, and this doesn't come to a surprise to us. Alberta is quite strong in resources, and Manitoba also has many good resources. We're not quite as big as Alberta, and then we've had a lot of discussion with our Saskatchewan team about the history and reason for lower level resources in Saskatchewan. And so when we start to think about reporting and disclosure, this is a very important context and framework to keep in mind, because the kinds of resources that occur in different regions, different provinces, will really shape a part of disclosure and how it can happen. And I think some of the data I'll talk about in a minute will highlight that even more. Okay, my slide just isn't, there we go. Okay, so the media scan, we put a halt on it a few weeks ago just because we had a new, we had other things to do. So it does not include the work on COVID, but we are actually starting to think about that in terms of seniors in the community. What will be really interesting is a kind of a comparative approach, because what we did previously in the last year or two is to just look in general at the kind of media that's happening in Canada on the topic of older adults and abuse. And so you'll see some of the ways in which we collected articles. We found most of the media covering this topic was in Ontario and British Columbia. We did find some in the Prairie Provinces, and many of the articles we originally found were just promoting Elder Abuse Day, June 15th. And so that was interesting. And certainly now looking at the media today, I would say there's quite a great difference between what we see in the reporting on this topic. So actually, it is notable to say that when we did this media scan, there weren't that many articles coming up in the Prairie Provinces on older adults and reporting abuse. So I'm sure that many of you are following the news, and what I'd like to invite you to do is look at this slide and actually really compare with what we're seeing in the news today. These articles are, you can see they're a little bit older, 2013, 2019, 2011. They just say, we're starting to a growing dilemma in an aging population. So this is how the news is covering this issue. Elder abuse cases seldom lead to criminal charges. That was another article from 2013. And, seniors speak out to end elder abuse. It's kind of like this area that the media was taking up as a new and novel issue, although I think those of us who've worked in this area for years know that that's not the case. So we can come back to this at the end when we also talk about what's happening in the news now. This is probably a part of the study that will be expanding a bit going forward. I wanted to talk about the literature that we have collected in this area. And again, the focus wasn't so much on types of abuse, but more on the issue of disclosure. So in searching for the literature and then analyzing and reviewing the themes, we discovered three primary themes. So importance of relationships, barriers to reporting, and service providers. So I'll just talk briefly about the literature in each one of those areas. So when we're thinking about disclosure, reporting is largely dependent on kinship ties, and the findings on this are wide-ranging, depending on whether an older adult feels a sense of loyalty and commitment, or whether there has been other kinds of conflict and breaking of relationships over time. And so when we look at who will disclose and to whom and how, we really need to focus on family and kinship ties to better understand how that disclosure happens. And we can also look at what the literature has told us about the perpetrators. So there's a fair bit of research out on this. I've just picked one for the talk today. And so we see that when we look at types of abuse like neglect, Adult children are the most common perpetrators. When we look at physical types of abuse, we see that partners and spouses are the most common type of perpetrator. And then you can see that psychological is similar. And one of the growing types of abuse that we're trying to understand better is financial. And so that would be family members and often primary caregivers. So when we look at disclosure, understanding the complexity of the family relationships or the kinship ties is something we see repeatedly in how we can approach the questions of disclosure and how to improve our work in that area. So there are also very real barriers to reporting, and I've just picked some of the themes that came up in the literature. One was an article I had written with Dr. Brownrich and Dr. Ursel, and just to reveal more fully that older adults don't really use the word abuse. They don't see themselves as in that picture, and they might use words like disrespect or mistreatment and many other terms. But if you ask them, are they being abused? We found in an earlier study that really older adults say, no, that's not me, that's not my experience. Also, when we get deeper into conversations, and this is revealed, shown in the literature here, fear of negative consequences of the abuser, and I think that's true for abuse across the lifespan. We see that in some cases, people feel that abuse is their fault and feelings of blame and embarrassment around that. And so we can also see the literature has done some work around timing, delayed reporting, and how close people are to the abuser, as well as not wanting law enforcement involved. And we heard that again in this study, which I'll come to in a minute. But the literature also says that having law enforcement involved is just not something that older adults want. With regards to service providers, and I would expand this even more broadly to say that includes law enforcement and the law and many other professionals working with older adults, that they will say that mandatory reporting really doesn't help to ensure victim safety. And so even though there's been much work and very good work done in this area, that mandatory reporting isn't something that older adults themselves necessarily think is that helpful, and the literature shows that. And we also see in many professions that service providers, and I wouldn't say this is all professions, but certainly in many professions, people don't have awareness on this issue. They lack appropriate training and resources. And so that's another thing that the literature did show us. So one of the aspects of our study was looking at annual reports, and we were able to look at some annual data from Age and Opportunity and Kirby Center. And so I'm just going to highlight some of the themes. They're not particularly surprising, although I will come back to some charts in a minute. So this is for many people who work in the area of abuse or with older adults, some of these findings may be very familiar to you. So females make up approximately 3/4 of those who reported abuse, given the data that we looked at. And in each year, and I think we're seeing this increasingly, financial and psychological reports of abuse are most prevalent. According to our data, and this mirrors what the literature says, is that adult children are reported most frequently as the perpetrators, and adult sons seem to be more often a perpetrator more often than adult daughters. In Manitoba, we do have a safe suite, and so given the data that we reviewed here, women reported using the safe suite more often than men, and reports of elder abuse most frequently came from urban centers, and information on reports from rural centers was less common or not even available. So you can begin to see some patterns and threads here around disclosure and reporting, who might be more likely to report, whether it's urban and rural, whether it's women or men. And this doesn't necessarily mean that abuse itself is happening at different rates in these areas. We're really just thinking about why is it that some demographics in some regions are more likely to disclose and report abuse. And so that's something that we're seeing here in these findings as well. So I'm going to present 3 charts, and they're highlights that we received from the different community organizations. And so when you look at this one, you can see this is an agent opportunity annual report looking at 2005 to 2019. And you can see that we're looking at financial and emotional abuse being quite high in the beginning, and then they take a bit of a dip, and we see that emotional abuse comes up again, and then at the end, financial abuse is a little more high again. And in discussion with the folks who are working at ANO and also Kirby Centre, which I'll present in a minute, we were talking about why those trends may look the way they do here. And one of the reasons we decided was that different awareness campaigns happened at different points in time. And so if there was a time where there was a big push for an awareness campaign around abuse of older adults, that might be one of the reasons why the emotional abuse was reported more highly in the 2014 to 2015 period. If we look at also which governments were supporting or promoting funding on this issue, whether it was service provision or educational campaigns or developing the Safe Suite, also call-in lines for crisis with a training and focus on older adults. As those resources go up and down, you will see different levels of disclosure. And so we need to think carefully about those contexts of federal and provincial support on this issue, as well as what the impact of educational campaigns might be on people's willingness to come forward and talk about abuse. A slide here on ANO's annual report 2014 to 2019, looking at adult children being the most prevalent perpetrators, family members second in line, and others referring to perpetrators such as friends, neighbors, tenants, roommates, a more general list there. So that gives you a bit of a sense of who we're seeing is being reported. And so this is a very parallel kind of slide from Alberta, Kirby Centre, which does amazing work and has some great resources for seniors, has some similar trends. And I was talking with them about the increase and decrease here on this slide. And the same reasons were discussed around federal, provincial support and education and awareness campaigns. So I want to talk a little bit now about our qualitative data that we collected. So for all of this work, we did get ethics approved from each jurisdiction. So each university had their own ethics approved. And we had recruitment posters which were distributed over 6 months a year ago at 3 intervals to different community agencies and in many different ways, emails and posting in buildings. And this included senior centers, public newsletters, health regions, older adult resource centers. So we worked very hard to distribute quite widely these posters in many different settings. And we were hoping to have recruited specifically older adults. And as we continued, we discovered, which wasn't a complete surprise, but we did discover that older adults were quite leery to come forward on the topic to be part of research. So in some provinces, we had a stronger response from older adults. Alberta was one. In Manitoba, we had a bit of a combination of family members who came forward to talk about abuse in their family, but it wasn't them. So they were coming forward to talk about abuse of an older adult in their family. And so they completed semi-structured interviews, and this was either with a trained counselor or a trained researcher. and they were able to select their own spaces, and some of the interviews did happen by phone, although I think many of them also happened face to face. So participants were asked to complete a demographic form, but not all chose to do so. So we didn't get that demographic form information from everybody. And we did assign pseudonyms. We audio recorded the interviews. I have been removing all identification from the transcripts now, and each participant, when sometimes ethics requires you to have the individual approve their transcript, and so when ethics required us to do that, we did go forward and ask the participants to approve their individual transcripts. So we also conducted interviews with service providers, and so those were similarly semi-structured interviews conducted by our research assistants, sometimes in face-to-face and sometimes by phone. And so that gives you an overall sense of our approach to seeking members of our communities to talk on this topic. Our sample for qualitative interviews is next, and I didn't separate the older adults from the family, but you can see in Alberta there was 10 in that category. Manitoba had 5, and Saskatchewan, despite a very good, strong effort, was not able to get any older adults. And then service providers, you can see, was 10 and 7 and 10. And so we have a nice, very rich qualitative sample to choose from, or to analyze rather. So I want to talk about 3 of the themes, and again, this is sort of our preliminary work around what's coming up in the interviews. We're in the process now of writing our first report and preparing our first papers. So we're very open to any thoughts that anyone has, and I'm certainly welcoming any discussion later on emails after the webinar is done today. So the themes that we have analyzed, and the analytic procedure was having the team come together and numerous different iterations to blind review several interviews, to come together, discuss themes, whether they overlapped, where our differences of opinion were, to go back and analyze the transcripts again, and then to share that with other team members. So there's been quite a lot of discussion and back and forth on the team to come up at this point with these 3 themes. So, or these 2, there's 2 main categories. So the first category I want to talk about is when disclosure works well. And our interviews have shown us that disclosure works well when the word abuse is not used. And as you recall, I've mentioned that had come up in the literature as well. And this is something we're seeing is probably very important going forward with disclosure work, that the word abuse is not something that older adults are comfortable with by and large. In our interviews, that's what we found. We also discovered that when public presentations are made, this is very positive and very useful, that it's an avenue for members in the audience to come forward and usually very informally just say, oh, I had a friend who had a situation, and they want to have a private conversation with the presenter. And in this way, there is a door that is opened for further discussion. And in our interviews, we found both from the service providers and from the older adults and family members that having these very informal conversations was really one good way to invite older adults to think about, well, if this is happening, what would be next steps, and what could be another way to provide support and resources. Another theme that we saw in our interviews was, rather than go for the mandatory reporting or the law enforcement being involved, that what older adults really found worked well was just small steps. This might be, how do I get out of the house when I feel like my life is at risk? Or how do I invite my nephew to be differently around the money I'm lending him? So that, in fact, the small steps or the strategies that just offer a more daily or temporary relief seem to be preferable for older adults and family members. And so it's sort of a big step away from taking big action or avoiding major changes in their life, which is very understandable. But definitely we saw that in the literature as well. So there are actually quite a few things in this list, and I've just picked a few for the sake of discussion today. So reporting does not go well when someone is punished, and older adults certainly felt, and family members and service providers, if someone feels that they're at risk of being punished, even to talk to their hairdresser or a friend or to have any discussion that the perpetrator may feel suspicious about, that would be preventing them to talk in any way about anything. Um, Also, some older adults were telling us it's unclear what activities they sort of thought should be reported. They didn't know, even if they didn't use the word abuse, if they talked about mistreatment, then, well, we shouldn't really report that. I was missing $10, $50. Someone wasn't returning my phone calls around an issue I needed help with. In one case, we found an older fellow was living with his grandson, and he just didn't really know how to manage his grandson's anger. He didn't really think it was abusive, but he felt it might be. And so I think this point is a very important point, that people are unclear what they should talk about or what they should even call abuse, but that these things were happening and they wanted to talk about them. The person being abused felt that they were not able to tell the truth to anyone. And so we also, this isn't a big surprise, but people would find they would give other reasons for why they might have bruises or why money might be missing. And so people were scared and ashamed and fearful about talking about where they might have gotten a bruise or where their money might have gone. And also we found, and this was perhaps self-apparent, but there were quite a few discussions where older adults said, I have talked to 20 people. I have told everyone I know. I have gone to 5 different sources. I've told them about my situation, but nothing is changing and nothing is happening. So I think we also have to think more clearly about older adults who feel that they are, really talking as much as they can about an abusive situation, but we need to find ways to support them and help them in what needs to happen next. But we did hear this in interviews that some of the folks were talking to lots of people. So when we're thinking about moving forward, and I would say we're still at the preliminary stage of analyzing our data, but these are just some of the emerging recommendations that have been coming up in our work. And so one of the things we found in looking at the annual reports of all our community centers and looking at what the service providers were telling us needed to happen in creating awareness on this topic with other professionals, that education is really key, that we need to create much stronger community awareness of abuse of older adults and to develop much better resources to combat abuse. And we need to create opportunities for older adults to talk about what is going on. And I think in one of my discussions with the community representatives on our team, is everybody was very much nodding their heads and excited to underscore this and say, that is key. We need to just create opportunities for discussion. And that isn't necessarily about disclosure or reporting, but it's just creating opportunities to talk. And that has to happen not just with older adults, but also with a wide range of professionals. Now, I just want to say briefly that with the situation that is happening in Canada right now around COVID-19, this is really one possible good thing that might come out of a terrible situation that we are being pressed and forced and asked to talk about what is happening to older adults in nursing homes. But my focus is in the community. And so I'm wondering what's happening to all the older adults who are living in the community right now, who might be isolated already before COVID-19 happened, but are now even more isolated. And if they are in abusive situations, how are we finding out about it? If we didn't know about it before, or they didn't feel comfortable talking about it before, with a quarantine situation, I think older adults living in risky situations would be even less able in the community to talk about this. So I hope in our discussion in a few minutes, maybe we can talk a little bit more about that. We do have some issues around housing, and one of the recommendations was that we need to provide housing for abused seniors, and that Safe Suite here in Manitoba is temporary. It's one opportunity for people to live there for a time, but we need to think more clearly about housing options for seniors who are in abusive situations. And I think we have some excellent counselors, social workers in all three provinces, but we just probably need more of that, more training, more people, more professionals in rural areas as well and in northern areas. And so we need to think about how can we provide better emotional and psychological support for older adults who do disclose. And of course, funding is always an issue. And this whole study is in the context of framework of ageism. So really thinking about how deeply embedded ageism is in our society, in our communities, in our culture, and to think about why, in fact, some of the testing and resources and inspections of different nursing homes and places and in the community also hasn't happened is just a reallocation of funding to other places, but we need to reinstate that funding so that it is going directly to older adults and their well-being. And so we need to think about how we can build capacity in that way. And one of the other recommendations, and this is around disclosure as well, if people aren't talking about their situations, we may know about it, but we can't, it's very hard to collect data. And so we found in the last year that thinking about where the sources of data were on this topic, that it looks like maybe older adults aren't being abused. Well, that we know that they are, but it's very difficult to collect data in this area. So we need to think really clearly about how we can establish a central organization that might be in charge of investigating older adults abuse and collecting that data. And that would be both at the population level, but also individual and qualitative research. And so if we can find ways to encourage discussion on this topic, this will also be reflected in how we can better collect data in this area. So one of the things that I wanted to do to just wrap up my talk, and then we can open it up to discussion, is that I have been doing some looking around at different resources that are popping up. And I think that because of COVID-19, we're seeing some new hotlines and call-in lines happening. I think that each of our centers, our community partners in this study have been working on that. So SCOA in Saskatchewan, Kirby Centre in Alberta, and ANO in Manitoba all now have been working either within their organizations or with provincial governments to create ways that seniors can call in if they need help with their groceries, with shopping, with other issues that might relate to abuse as well. And so I want to encourage anyone who's on this webinar to please do contact your local community centers supporting older adults and ask them, do you have support on this issue? What is the support? How can we help you to have this kind of resource? And I noticed that there was the federal government has provided some funding to United Way to support seniors in this time, so that should come down to the community organizations. And I was happy to see some local grocery programs starting up that were going to provide services specifically to seniors who are isolating in their houses. So I do see some changes just right now due to COVID-19, but we need to follow this thread and continue work in this area. So I think at this point I would like to open it up. I guess firstly I'm really happy to hear any questions about this study itself and what our team has found. I know some of my team members are on the line as well, but I'm also happy maybe once that's done to hear more what everybody is thinking about COVID-19 and what we're hearing in the news right now.
Thank you, Kerstin. That was great. I actually have a couple of questions for you already. So,
Can I
first,
check out of my presentation or should I leave it on now?
yeah, I'll take care of it. Don't worry.
Okay,
Uh,
okay.
the first question is from Charlene. She's saying, this is really great information. Did the topic of lack of funding, which you addressed a little bit, did the topic of lack of funding to address elder abuse come up in any of the research from the perspective of service providers?
Yes, I think that one of the interviews I remember most clearly was an RCMP officer and a social worker, and both of them spoke about the frustration in trying to build teams that could work together as a team to go into the community, and that the resources, the financial resources, were not there for that. So that came up for sure. And I think the other place that we've seen it most vividly is in Saskatchewan. You know, as we were continuing to sort of document the resources available, we've talked a lot with our community partners in Saskatchewan, and they just have not, despite really significant lobbying and work on the ground, they have not been able to procure the same kind of funding. So really strongly coming up just on our research team as well as with our interviews.
Wonderful. Next question for you is from Sylvia, who is conducting a similar research in different countries from Europe. Sorry, I should say she's conducting the research from Europe, but with different countries, including Canada, I believe, yes. And she is looking to hear from people who have supported victims informally, like family members that approach them. And sorry, I keep losing my question. She is wondering if you have any additional tips or feedback on recruiting in the field of elder abuse, whether it is recruiting people who have been victimized or others, without having any direct support from organizations and with the challenges of the lack of centralized data. So tips
Ah,
on reaching the right people.
I might know this Sylvia actually. So hi
Ah,
Sylvia, if you're the Sylvia that I think. Um, so yeah, tips on recruiting. My greatest successes have been when I have gone into the community to meet with people and they get to know me and they find, oh, you know, I could talk with her versus posters and phone calls and all the other ways that we sometimes recruit. So it's tricky because it's very time intensive. And in Manitoba, I found that any success I've had with recruiting is with, you know, people getting to know me.
okay. Do you have actually another question asking you for suggestions? Do you have suggestions for opening more conversation with seniors given the additional constraints resulting from COVID-19?
I don't know. I think that maybe, you know, I'm happy to give it a stab, and there might be others who can write in the chat and offer their suggestions as well. But I think that, you know, seniors, as we all know, they're not one homogenous group. And I think the ones who are willing and able to use technology, texting, FaceTime, Zoom, there are lots of seniors out there who are using technology well. So then we really ask, well, how can we reach the seniors who are not using technology? And uh, I have to say, I do know some people who are in a nursing home. They have not had contact with anyone for weeks, and they're not willing to, they don't have a cell phone, and they're not interested in using a cell phone. So the regular telephone works, and then phoning them and, hearing how they're doing and what's happening. But I think maybe I'll ask what others think about this.
Great. So if you have other suggestions and you're an attendee, please feel free to type it up in the chat box. Next question from Leah. Thank you for this important research. Do you know if anything is being done with respect to the Canadian Criminal Code to criminalize the mistreatment and abuse of elderly people who are as vulnerable as children?
Right. Well, I understand that is very important, and people have been working on that across Canada. I think that the last work that I heard was happening in British Columbia around that. And so I think it's really important. Having said that, my interest is around working with older adults in the community who are thinking about disclosing and want to disclose. And so I think that's equally important. How can we have to work at both ends of that spectrum. And so I myself am not working on that, and I don't know of any forward motion in that regard right now.
Okay. Next question from Jacqueline. You are on fire today. There are lots of questions. I love it. So, from Jacqueline, since the identifying information from the study has been removed, is it possible to get access to the transcriptions of your study?
Well, usually what we would do, and that's sort of what we're working on right now, is that we're compiling the themes and then preparing a report and a paper. And so in this way, we're hoping to uh, deliver, or disseminate the most important data that we as a team think is worth sort of disseminating to the community. So we don't normally share transcripts, so I haven't done that in the past. So hopefully, if we get a report out, that would be helpful.
Okay. And we have a question from Kevin, who is the facilitator of the Peel Elder Abuse Support Program. Peel region has identified approximately 128 different cultures living in Peel. I've noted that while one group would view what one group would view a situation as abuse, another would consider a cultural norm or not abuse at all. Did you encounter anything along these lines in your research?
Yes, I have over time, I think, in many ways. And so, um, working with different cultural communities and organizations is really important because sometimes if we are not members of a certain culture, we don't understand the complexity of some of the norms that occur. I think that we're not welcome or really invited in then either. And so I think that working with different communities is really important, and not to make assumptions or to sort of impose specific, ways of understanding this, because I don't think it's helpful if sort of, I think that we work with many different people from many different communities. And I think it's really important to build those relationships with those cultural communities. And it might be LGBT, it might be Indigenous. I think that some rural parts of Canada also have, their own ways of thinking about things. And so that's really the first step for me, is to build those good relationships with those particular communities.
Wonderful. We have a comment from Rayanne of Elder Abuse Prevention Ontario. Actually, that's quite on point, reminding us that there is a webinar coming up from EAPO about navigating relationships in trying times, especially in the context of COVID-19. So this might answer some of the questions that one of you had earlier. So the link is in the chat box, and we'll also be publicizing that webinar and supporting the promotion. So keep an eye out. Next question from Jill. My concern is that there are resources for reporting and education around financial abuse. Why is there such reluctance to refer to resources to mitigate the risk or Why is there such reluctance to refer to resources to mitigate the risk of or deal with financial abuse? I'm not quite sure I understand.
I don't know if there's a fear to do it, and I hope I'm understanding the question. But what I have found most recently in these interviews is that the issue of finances within families is very complex. In one case, where an older fellow had a lot of money and uh, he so the decisions I'm trying to frame this answer very carefully. I think that financial abuse is a tricky one. We don't know enough about it. We haven't had a lot of history around reporting and disclosure around it, and there's many I'm aware of many issues related to financial abuse. So I don't know if it's fear, if that was in the question. I think it's still very new and very complex, and maybe we're just not sure how to approach it. But I don't feel that that's a very good answer. So maybe Jill can email me later and we can talk more about it.
Okay, there she actually has a follow-up question um, about researching what leads family members to abuse elders. Do we know if it is linked to childhood trauma, personality disorders, situational aspects, other?
Well, it could be all of those. I would include addiction to the list. And what it wouldn't be one or any one more than another. I think that abuse can come from many different places and it can be lifelong. It can happen just because someone is older and now they're seen to be more vulnerable. So I think the reasons for it are many. Can you repeat the question?
Sure. Um, where is it? There it is. What about researching what that leads to, sorry, it keeps jumping, leads the family members to abuse elders? Is it a childhood trauma, a personality disorder, or situational aspects?
Okay. Well, I think there's some literature that looks at issues around control as supporting, that the perpetrator has some issues with control and wants to be controlling or has a history of being controlling. That might be one way to think about it. But to say that it's childhood trauma, we don't know that it is in all cases. And to say that it's a personality disorder, I don't think we can say that. So there's been quite a bit of research looking at the reasons for abuse. And I would say in this case that we do still live in a society which is deeply ageist. And so even when you layer it with these other issues that are mentioned in the question, I would say that we still are willing as a society to treat older adults based on age in a way that we would find unacceptable or in some ways reprehensible for any other age group. So if we think about some of the things that are occurring with older adults now, if this was any other age group, the way that it would just not like the outcry would be very different. So I think we still live in a very deeply ageist society where we accept things that really are unacceptable.
I think you're quite right. We have a few folks are sharing some resources that if you're not seeing the chat box, if you're on the phone, both in Alberta and in Winnipeg, sorry, Edmonton and Winnipeg, mentioning the Seniors Center Without Walls program
Oh,
as a
great.
great
Yeah.
way to connect with older adults who do not use computers or technology to communicate. So there are links in there, and particularly in Winnipeg, as a result of COVID-19, they have added a program called Daily Hello, where older adults can call into, and it's an opportunity to check in with each other and get information on resources. So you can find a link to that information on the website for AO Support Services, Age Opportunity Support Services.ca. Sorry, AO Support Services.ca, which is Age Opportunity. Um, and also, Rayanne pointed out for the person who was asking about the criminal code earlier that the mandate letter for the Minister of Seniors has stated that they're going to establish new offenses and penalties in the criminal code related to elder abuse. So that's another thing you can refer yourself to. And I think for now, at least, our last question is there evidence that there is a higher likelihood of reporting by others if the adult lacks capacity?
There is no evidence for that in my work, at least, and maybe others have found otherwise. But the issue of lacking capacity is um, a troubling thread in all of this.
Okay, so we have 5 more minutes. If you have other questions, now is your chance to ask them. If not, you should be able to see on my screen, I've added Kerstin's email address here, and you will be able to find it, or even just email me and I'll connect you happily if you want to follow up or ask more questions to Kerstin and her team. So I'll leave the chat box open for just a few more minutes, just in case. Otherwise, I think we might call it a day. Any last words, Kerstin?
Thank you so much for hosting this. And I have to say that when I prepared this, and our team has been working on this study prior to COVID, it was a troubling issue, but some of the things that have happened in the news lately and in nursing homes, I hope that we can all keep that in mind and think about ways that we can reach out to seniors and also ask our local politicians and service providers to think, what can we do better moving forward?
You are quite right. Well, thank you very much for your time today, all of you, for presenting and for attending. I'm going to be adding the recording and the slides to our website in the afternoon. And as I said before, if you have any questions, you can get a hold of myself or Kerstin by email. We'll be happy to answer and connect you all. Thank you very much, all, and I hope you have a good day. Stay healthy and upbeat. We'll talk to you soon.
Thank you very much.
Bye.